10 fingers, 10 toes, and one little red nose. A child is the world's greatest blessing. A new parent, or even a well-seasoned one at that, never wants their child to be known as premature. Today we are going to familiarize ourselves with the history of an organization known as the March of Dimes. I've done extensive research about this organization, as well as donated to their cause from a young age. Today, to understand the history of the March of Dimes, we will look through their rich past, a significant change in their research, and third, their strong presence today. Let's begin with their beginnings. The March of Dimes history has a rich past. The March of Dimes has gone through several name changes over time. President Franklin Delano Roosevelt founded the organization Georgia Warm Springs Foundation in 1926 after the springs he used for therapeutic effects after contracting polio at the age of 39 in 1921. In 1938, he changed the name to National Foundation for Infant Paralysis and waged his war against polio to find a cure. Again in 1938, the organization gained its present-day March of Dimes because of a fluke that happened at an organization benefit. This is a photograph of President Franklin Delano Roosevelt and comedian Eddie Cantor. According to an online article written in 2009 by the history staff on the History Channel website called January 3, 1938, Franklin Roosevelt funds March of Dimes. At one fundraiser event, celebrity Eddie Cantor jokingly urged the public to send dimes to the president, coining the term March of Dimes. The general public took him up seriously on this offer and sent 2,680,000 dimes flooding into the White House, along with thousands of other donations. Thus began the present-day organization being called March of Dimes, and Eddie Cantor earning a very special place in their history. The March of Dimes has also gone through several research topic changes over time. According to an online article written by William Barrett on Forbes website, written on November 10, 2008, called March of Dimes Second Act, President Franklin D. Roosevelt founded it in 1938 as the National Foundation for Infant Paralysis to help care for polio victims and to find a vaccine to prevent new cases. According to an online article written by David Ross on August 26, 2010, called The History of the March of Dimes, featured on the March of Dimes official webpage under the Missions page on the History of March of Dimes tab, on July 22, 1958, at a press conference held in the Grand Ballroom of New York's Waldorf Astoria, he announced the Foundation's new mission, birth defect prevention. The next shift in focus came about in the 1970s when the March of Dimes research was fully engrossed in the prevention of birth defects and infant mortality. The research encompassed the study of premature birth and low birth weight as a result of being so involved in the research of birth defects. Now that we've discussed the March of Dimes' rich past, let's look at a significant change in their research. The March of Dimes organization had a significant change in their research. The last change came in 2003 when the organization launched its prematurity campaign, narrowing focus to prematurity in babies. If you're not familiar with the phrase premature, let me give you a brief definition. According to the 2016 Premature Birth Report Card, found on the March of Dimes official webpage, last updated 2017, premature or preterm birth is birth less than 37 weeks gestation based on the obstetric estimate of gestational age. So in simple terms, it's a baby born before 37 weeks of womb time. Here is an infographic of a mother carrying a child and the stages labeled preterm through postterm. As you can see, 37 weeks is, anything before 37 weeks is labeled preterm. And also you can see that 40 weeks is highlighted in blue. This is because this is what doctors would like babies to be in the womb. No parent wants their child to be born premature, as it can be both a psychological toll as well as a financial one. According to an online article last updated October 2015 titled The Impact of Premature Birth on Society, found on the official March of Dimes website, babies born this early may have more health problems or may need to stay in the hospital longer than babies born later. In 2007, the estimated cost associated with premature birth in the United States was about $26 billion. Now that we've talked about the March of Dimes' most significant change in their research, let's cover their current mission. The March of Dimes organization's history has a strong presence today. The March of Dimes follows a strict mission that I found listed on the missions page of the official March of Dimes webpage, last updated 2017. Their mission is as follows. Prematurity is the #1 killer of babies in the United States. We are working to change that and help more moms have full-term pregnancies and healthy babies. From polio to prematurity, the March of Dimes has focused on researching the problems that threaten our children and finding ways to prevent them. As you can see from this visual image of the United States gathered from the March of Dimes official webpage that portrays grades per state based on the preterm birth rates from the National Center for Health Statistics 2015 data, the United States as a whole received a C on the premature birth report card in 2017. The state of Missouri, highlighted in yellow, also received a C according to the report, with 10% of the babies being born in 2015 premature. Greene County, which we reside in if you live in Springfield, Missouri, reflects as receiving a C as well, and coming in at 10% in 2015. This is bad news for new parents here in Missouri. As mentioned earlier, having a child born prematurely is both psychologically pressing as well as a financial burden on not only the parents, but the society as a whole, as children born prematurely tend to have more health-related issues than children born after 37 weeks. In 2016, for the first time in 5 years, the preterm birth rate worsened. As we approach the end of 2017, March of Dimes as an organization is in high hopes that they've done enough to reduce this number. In conclusion, we've discussed the history of the March of Dimes organization. The March of Dimes organization has a rich past, a significant change in their research, and a strong presence today. Let me refer back to the baby in the beginning with 10 fingers, 10 toes, and 1 little red nose. He or she was born after 37 weeks, and he or she is a March of Dimes baby.